Hello and welcome to Optimum Live. My name is Martin Crowson. I'm here with Tom Heeley today. And if you're the sort of person that suffered with backache at some stage in your life, haven't we all? Today's a really good episode for you to tune into. We're looking at sciatica, what it is, what causes it, and how to guard against it, as well as how to get better from it in the short term as well. So please stick around. You're very welcome today if you're watching on either YouTube or LinkedIn. A very warm welcome to my guest, as always, the MD of Optimum Derby, Tom Heeley. Tom, how are you?
Yeah, good, thank you. Good. Good little weekend away with Derby County. So just come back from that, which was great. We went to Malta. The lads didn't do that well, but it was a good weekend all in all, and a great experience for the kids. Really good experience for the kids. It was excellent to see them sort of take on that foreign setting and foreign surrounding. It was really interesting.
Get your shorts out.
Shorts were on 16, 17, 18 degrees, which is perfect for miserable grey England at the minute. So no, it was good. Excellent trip for the kids. Really, the kids really enjoyed it. Despite the football, that kind of doesn't matter. That's just a secondary thing, really, in a way. I think for those sorts of experiences. But really good, really good.
Okay, good, nice one. Let's crack on. Talking of dull and damp English weather, it doesn't do backache much good, does it? But sciatica is something that we often hear about lots and lots of people suffering from. So for starters, just to briefly, before we get into it, what is it? What is sciatica?
Well, sciatica's kind of got a couple of different areas and ways of sort of, I suppose, exposing or delivering pain. So within your back, you've got the vertebra, and the vertebra are stacked from top to bottom, all the way from your head all the way down to your bum. And in between each vertebra, you've got a disc, which is almost sort of jelly shaped or jelly in sort of texture. And it's round. And behind that, you've then got the spinal cord. So the spinal cord runs sort of towards the back of the spine. And the sciatica pain is obviously like pain in the back of the legs or numbness, pins and needles, tingling, generally sort of through your hamstrings and maybe into your bum a little bit as well. But where it sort of comes from is in sort of 2 or 3 different areas, what it could be. But the main sort of pain, the signs and symptoms are sort of lower back, bum, hamstring sort of area pain.
Yeah, because it's quite a strange one, isn't it? You feel it in your back, but then it can make some mind say it's gone right down into almost the lower hamstring at times. Yeah. And that's maybe how you discern it. Going on to my next question, how do you discern that from other sorts of backache, and what's the difference between the two?
Yeah, absolutely. Like your friend just said there, sort of it goes into his hamstring, in which case you might think it's potentially a hamstring problem. But in actual fact, once you start to kind of unravel it and sort of take layers off and start to listen to what the individual's got to say about how the pain comes about or when it started, likelihood is a hamstring is going to come about from some sort of sprinting or change of direction. If this person doesn't do any of that, then the likelihood is it's not going to be a hamstring problem or a hamstring strain or tear. So you can almost rule that out. It's a matter of where's this pain coming from. So piriformis syndrome is probably another topic which we may well do a blog on. But piriformis syndrome is another area that could permit pain down through the hamstrings and elicit sort of sciatic type pain. And essentially, sciatic pain is where the nerve gets squished. So whether that's something squeezes onto it, or whether something compresses onto it, a hole that it travels through, the nerve travels through is narrow. That then elicits pain further down, and not only pain, but it can also elicit sort of dysfunction. So the muscles become weaker, and the signal coming back up also becomes dampened as well.
Okay, how hard is it to diagnose for starters? Somebody says, they've got a backache. Yeah. How do you know the difference between that and sciatica in terms of the treatment model and going forward?
Yeah, so I would almost place sciatica and backache into two almost separate sort of columns. Backache I would almost put down to maybe some sort of biomechanical issue as such. Maybe you've got some sort of a pelvis issue going on, or you've got like a pars fracture, or you've got
what's that, Tom? What's that?
So a pars fracture would be if you've got, if I can show you like that almost, if you take my middle finger as being the bit you can feel in your spine, and you take like the palm of my hand, the chunky bit, as being the weight bearing part of the spine. You've then got these 2 pieces. So my index finger and my ring finger are then 2 pieces that sort of stick out. The vertebra below has got exactly the same, but they almost stick upwards. And you have this interaction where those ring finger and the index finger almost rotate around, and that limits the amount of rotation you get.
Right.
If you take that up to the top, Martin, look at the neck will almost slide, whereas the lower back will almost hit, almost like paddles.
Okay.
But if you repeat that stress over and over and over again, you can end up with a small stress fracture called a pars fracture.
Right.
So
okay.
I would put that and sort of muscular type lower back pain in one column, and then in the other column you'd have sort of sciatica. You'd have I've lost my words now. What's it called when you get stuck? Facet joint irritation. So you get I think you've had a little bit of that, haven't you, in the past?
Yeah.
So again, it's almost that same sort of stress, but instead of it becoming a fracture, you just get swelling within that joint, and that joint then becomes irritated. That can also impact onto the nerve and affect the lower back as well.
And for those of us that are backache, we all know that comes in various different guises and types of pain. Does sciatica offer a very specific level of pain, or does that vary in a similar way to regular backache?
Different again. So regular backache, I would say, is probably going to be there almost all the time, and may ease a little bit if you get up and walk around. Sciatic pain will be there if you do specific things. So if you specifically bend down and touch your toes, you might not get pain specifically in your lower back. This is the funny thing. You might not get pain actually in your back. You might get it directly down your leg or directly down your hamstring. So things like stretching, so you might try and do some lower back stretches, might actually make the sciatica worse. So I think once you get it cleared up from the beginning, it's quite easy to manage the two. Whether it's routine lower back pain or whether it's more something a little bit more serious, I think they're quite easy to clear up and manage properly once you've diagnosed it correctly and you've got an understanding of what's going on.
Okay, we'll get on some treatments in a second, but it's probably a good idea at the moment just to remind everybody, if you watch on YouTube and you're not subscribed already, please do so. You'll know exactly when we're back on again today. And just a reminder that there's already a whole host of information you can pick up on the Optimum Derby YouTube channel with various sorts of injuries and ailments that we all suffer. Anybody that plays sports, men or women, can go on there and find out plenty more information. If you have any questions while we're broadcasting today, please stick them in the comments box, and if we can't answer them during the show, Tom will endeavour to get onto them afterwards. Let's get back to it, Tom. There's one of those sort of views that sciatica is for old people. Is that a fair comment? And if so, if not, why?
No, it could be. Honestly, it could be anybody. My back's behind me, so like a cyclist. So being in that position for a long period of time, let's say you're doing a long endurance event, 3 or 4 hours, plus all the training that's going with it. If the bike's not set up right and the saddle's not quite the right height and the handlebars, you could end up in a position that compromises those discs. And if we go back to that disc scenario again, if you imagine the discs are jelly substance and you've got 2 sort of dinner plates squashing between the jam, if you squash on the front of the jam, the jelly is going to shunt backwards. Well, if it shunts backwards, there's potential it's going to put pressure onto the nerve as it exits the spine and then goes down your legs. So being in that sort of rounded position for too long can cause that compression. So equally, going the other way would relieve some of that stress. Right. So some real simple things like that. So like bike setup, for example, that could be a 20-year-old person, you know, or it doesn't have to be.
It's wrong, whatever age you are.
Doesn't matter. Really doesn't matter. Doesn't matter at all.
Okay. Short-term help for people that are struggling from it. Ice, heat, exercises.
Yeah, I would certainly go down the exercise route for this. I think I probably wouldn't heat it, and I probably wouldn't ice it until you know directly what's causing it from 2 or 3 different options that could cause a sciatica. I wouldn't ice or heat just yet. I would certainly go down the route of doing some gentle movement. So generally speaking, with sort of sciatic type pain, anything that's going to go into extension. So if you lean away or lean backwards would settle your symptoms a little bit.
Okay. Hold or reps or?
Yeah, absolutely. So if anybody's sort of familiar with yoga, like a cobra stretch would be useful. So almost lay down flat on your tummy.
Yeah.
Hands into a bit of a press up position. Keep your hips fixed to the floor and your legs flat, and then just push through your hands and almost arch away from the floor. Okay. That's a real useful one to try and take the stress, particularly off the disc, and give that nerve a little bit of space to sort of open again and allow the flow of the neural pathways down that nerve and relieve some symptoms. So that's definitely one. Things like bridges would also be real useful, even if it's only a partial range. So even if it's not fully sort of bum from the floor, bum all the way in the air, even if it's just bum off the floor to an inch or two and then come back and then return. And over time, the stronger you get and the symptoms settle, you'll start to be able to lift higher and higher. And then generally speaking, the third one I would look to focus on would be sort of hip flexor stretching. So if that's like a lunge position, so foot on the floor, knee on the floor, so left foot on the floor, right knee on the floor, drive your hips towards the left foot, keeping the knee fixed, and then just opening up that right hip flexor would be also a real useful one to consider straight away.
Okay. So I've tried those. It's not going me very far. I've decided to come and see you to have a proper look at it. What are the occasions to use heat and what are the occasions to use ice? And then long term, not only trying to make me better, but is there anything I can do around the house just to guard against it happening again if it's flared up before and I've got rid of it?
Yeah, I think I would certainly, if we find out what the particular cause or the root is, heating certain areas would be useful because it would help to relax some of the tissues to give you a bit more freedom and take the stress off that nerve ending. Ice would be useful if we figured out that it was maybe more of an inflammatory issue. So if there was more inflammation causing the compression on the nerve, then the ice may be useful as well. Another couple of things.
Yes, those two reasons, Tom, are a really good reason why people should come and see somebody like yourself first, because it just goes to show that you could be doing the wrong one of the two.
Yeah, absolutely. Ice isn't always a fix, and neither is heat. So picking the right one at the right. If you put heat on an inflammatory issue, it's only going to get more inflamed. So you're almost going to make the problem worse in a bad way. And then generally speaking, back pain is better for movement. So even if it's just going for a walk in the morning, first thing in the morning, getting up out of bed, going for a walk, just 10, 15 minutes around the block, just to free movements up, free the hips up, and just start to get some gentle rotation through the lower back would be really useful. And again, try and do that a couple of times throughout the day. So if you're working from home, take phone calls stood up, have a standing desk, go and make a cup of tea every hour, or just move around the house once or twice an hour would be great. And then getting out at lunch and getting out in the evening. It doesn't have to be far, 10, 15 minutes, just to move. And you'll feel some great benefits just from that.
And I suppose that's the benefit for long term as well, isn't it? Just that get up and keep moving if we're looking to try and guard against it reoccurring.
Yeah, especially, and there'll be once we figure out what the specific cause is, we can go real specific with our exercises, and make sure that long term you've got maybe a plan of 2 or 3 things that you do, a few exercises that you do 2 or 3 times a week, plus maybe swimming or yoga or whatever it may be that actually is beneficial for you and your issue. And then maybe you just factor that into your day-to-day activity, and turn your exercise almost into your prevention. Rather than calling it just prevention, it just becomes boring. We can turn the two into one.
And apart from the cyclists that you just mentioned earlier, do you see a lot of it in the other guys as you do sports-wise, footballers, cricketers?
Yeah, cricket is pretty common. It's not so common with the snow sports guys, just because of the way that they move. Most of the injuries are quite extreme, so we don't tend to get this type of issue. But yeah, cycling you tend to get it. Running, I've seen it in the past as well. Long distance runners who maybe have got an old, let's say, knee injury, so they're not absorbing the force through the knee, and therefore it transfers up, and they start to get this compression on the disc and so forth, so on and so forth, and that leads to a sciatic issue. So it doesn't necessarily have to be something where you're in one position for a long period of time, like sitting at a desk or cycling a bike. It could be running, or it could be other sports as well.
Yeah, and as always, if people are struggling and wondering what to do with their bad back, a good idea to come and book in with yourself.
Yeah, or even just drop a comment in below and just ask a couple of questions if there's something that you're thinking that you might have something similar to this, or some sort of lower back pain. Just drop a comment, and yeah, we'll look to get back to you.
Great. Thanks, Tom. That's really interesting. Thanks for your time today, as always. If you'd like to find out more about Optimum Derby, the website address is on the bottom of the screen now. Please have a look. If you're watching us on YouTube today, please subscribe, as I mentioned earlier, and find out when we're on next time. If you want to email Tom to find out any more information about any subject or booking for an appointment at Optimum, there's Tom's email address. We are actually back on Wednesday this week, in 2 days' time, when we're going to be talking about repetition and 3 sets of 10 at the gym, whether that's still the right way forward or whether there's different approaches, which I sense there might be, that Tom can explain to you and explain the benefits of those. So please catch up with us again on Wednesday if you've got time. That just leaves me, Martin Crowson, to say thanks a lot for joining us today. Thanks for your time. Hope you enjoyed it. Please check out the other videos we've got on YouTube. Tom, thanks again. We'll see you Wednesday, mate.
Thank you very much. Cheers, Martin. I'll catch you soon.
And thanks a lot for joining us here today on Optimum Derby Live. All the best. Bye-bye.